Hi there, it's Dr. Zwelling, and I want to talk to you today about dental health. You know, it's a funny thing in healthcare. For some reason, we segregate the mouth and the teeth and the eyes from the rest of the body. Doctor takes care of everything else, unless, of course, it's your tooth, and then we don't know a thing about the mouth or the eyes. And the ophthalmologist, well, they talk in a language I have no idea. And then the feet. Well, that's kind of crazy because, of course, the mouth is, well, it's the gateway to everything, right? And the eyes, well, if you look in the back of the eyes, you can detect a lot of things, including cardiovascular disease. And you can look at the feet and you can tell if somebody has cardiovascular disease as well. And so with the mouth. It is absolutely true, and I think you've probably heard this before, that periodontal disease is a huge problem when it comes to cardiovascular disease and vascular disease in general. And today I had that one more rude awakening about we have to remember and know some good dentists. So I have some patients here in my practice who have some difficulties with their inflammatory markers, and I just can't get a hold of them. So I sent them to the dentist, and we do a test here in the office called oral DNA. Oral DNA is a means of looking at the bacteria in your mouth and seeing if there are the specific pathogens that can elevate the plaque 2. You may remember we talk about the plaque 2. That's that enzyme, that inflammatory enzyme that can be a problem. In any event, we've had tremendous success with finding the pathogens, taking care of them, and then, of course, obviously monitoring the plaque 2 and watching it just plummet after we take care of the mouth disease. Funny how that happens. In any event, one of my biggest problems is finding dentists that will help pursue this with me. But there's a doctor all the way back in Pennsylvania, Dr. Nagelberg, who's an expert on this, and he's helping me take care of this patient. And he also, it was interesting, he's a dentist, I'm a doctor. He tells me how difficult it is to get doctors to talk to dentists. I'm telling him how difficult it is to get dentists to talk to doctors. Kind of crazy, huh? So I guess the rule for today's bi-weekly update is make sure your dentist checks really well for periodontal disease. Ask him if he knows about the periodontal heart connection. And if he doesn't, find another periodontist. Make sure that mouth is clean. And in further talks, we'll talk about the biofilm and how we can make that a lot cleaner surface. But I will tell you that the mouth is a very important agent of disease, and it's mostly infectious disease. Not only can it be a perpetrator of these bacteria that can cause cardiovascular disease directly, but if you have dental work and you don't take the proper antibiotics and you have valvular disease, well, you can get a vegetation on your valve, a growth on your valve that's infected. And that can go anywhere in your body. I've seen it cause strokes. I've seen it cause leg infections. It can be a real harbinger of disease. So the rule for today is take care of your mouth. It's very important. And have a really good one. And for my Jewish friends, happy Rosh Hashanah, and have a very nice Yom Kippur, and happy Labor Day, and be safe and be well. And for all those going back to school, have a wonderful year. I'll talk to you in 2 weeks. Bye-bye now.